Hello and welcome everyone to our Medicare 101 webinar. My name is Steve Germain and I am your host. And today my task is to help you navigate through the Medicare maze. Some of you tuning in to this webinar may be turning 65 within the near future. Others may be 65 and older, and you are at a point of your life where you'll be retiring. Maybe you're coming off of spousal coverage, or maybe you're coming off of group coverage. You are definitely going to find the topics that we discuss useful. It's going to give you everything that you need in order to make the best decision possible as you move forward in regards to Medicare. Now, a little something about myself. I am located in sunny Miami, Florida. I'm with A&E Insurance Agency. I have been doing this for a little bit over 10 years. We specialize in all things to do with Medicare, and I truly have a passion for what I do to such an extent that I went ahead and I authored a book. It's called Medicare 101, A Beginner's Guide to Understanding Your Options. And this book truly is a valuable resource. It complements this webinar very well, this presentation very well. And at the end of this webinar, you do have the option of requesting this book, and we'll be more than happy to email it over to you, a digital copy, or to actually mail you a physical copy. Don't hesitate, feel free to request it, and we truly will be more than happy to send it over to you. Some of you tuning in to this webinar may be located throughout various parts of the United States, and we are licensed to serve you wherever you are throughout the country. So you will definitely find the information that we are giving to you useful, and we are able to help you wherever you are located. Now, a quick housekeeping item. We are going to ask as well that you grab a pen and a paper so that we can take some good notes. We're going to go over a wealth of information, but I'm going to do the best job that I can to make things easy and simple for everyone tuning in to this presentation to understand. Now, without further ado, let's get started with our Medicare 101 presentation. Our first topic of conversation is Original Medicare. Now, Original Medicare does consist of two parts. You have your Medicare Part A, and you also have your Medicare Part B. Now, Medicare Part A is hospital coverage. So that's going to be anything that has to do with inpatient hospital stays, inpatient hospital care. Now, you're also going to have skilled nursing facilities fall under the umbrella of Medicare Part A, and also hospice falls under the umbrella of Medicare Part A. As you see here, it says 0 monthly premium. The reason being, so long as you've worked in this country for a period of 10 years full-time, you've actually already paid into Medicare Part A, and there's no premium that is associated with having Medicare Part A. Now, on the other side, we do have Medicare Part B, which is doctor's coverage, right? So that's going to be anything that is done in regards to primary care, in regards to specialists, outpatient care. Some of the other things that may fall under that umbrella are going to be lab work, diagnostic test and imaging, durable medical equipment. All of those fall under the Medicare Part B umbrella. And as you see here, the monthly premium for 2024 is $174.70. That's how much the average American will pay for Medicare Part B. Now, every year that premium does change. Sometimes it's a few dollars less. Sometimes it's a few dollars more. For 2024, it happens to be $174.70. We don't know what it's going to be for 2025 as of yet. Now, for those of you who are receiving early Social Security, maybe you started receiving Social Security at age 62 or a little bit later. Well, you're automatically going to be enrolled in Original Medicare. Your Part A and your Part B will be effective the first of the month that you turn 65. You don't have to do anything. As a matter of fact, about 3 months prior to turning 65, you will receive your red, white, and blue card in the mail, and it will be effective the first of the month that you turn 65. The only exception to that rule is for anyone who was born on the first day of any given month. Their Medicare Part A and Part B will be effective the month prior to them turning 65. And you will also be automatically billed. The $174.70 will be deducted from your Social Security check the month that you turn 65, essentially. So it's a seamless process. If you're receiving early retirement, you won't have to do anything. You can expect to receive your red, white, and blue card in the mail about 3 months prior to you turning 65. Now, for those of you who are not receiving early retirement, the process is going to be a bit different for you. You're actually going to have to manually enroll in Original Medicare. There's a few different ways that you can do it. As you see here, we have the website ssa.gov. That may be the easiest way to do it. You would go to ssa.gov. You would create an account. If you don't already have one, you would go to apply for Medicare, and you will go through the process, the process of applying. And essentially within 2 to 4 weeks, you should get your approval and your card should be on its way to your home. And now the other way that you can do it is you could also do it over the phone. You can call the number that I put here, 1-800-772-1213. And essentially what will happen is they will set up an appointment for you to get a call back at a later date, and someone would be able to assist you over the phone. And you can always go in person to your local Social Security office. And the least recommended way is by mailing in an application to Social Security. The reason being is anything could happen when you mail it. So I do highly recommend the other 3 ways that I mentioned in enrolling. But if you would like to, you could also mail in the application. Now, the billing process for Medicare Part B is going to be a bit different as well. Now, when you're, as I mentioned previously, those who are on Social Security, they're going to get billed automatically from their Social Security check. But for those who are not receiving Social Security, you are actually going to be billed on a quarterly basis. So what that means is upon you receiving confirmation that you have your Medicare effective the month that you turn 65, shortly after, you're going to get your first bill. And your first bill is going to be a quarterly bill. And it's going to be for 2024, it's going to be $174.70 times 3, right? And that should be $524.10. Now, for those of you who don't like the idea of being billed on a quarterly basis, you do have the option of enrolling in what's called Medicare Easy Pay. And essentially, it's just automatic payment. You would go to Medicare.gov. You would also create an account. And once the account is associated with you, you would be able to put in your banking information. And instead of getting a bill quarterly, they would instead bill you on a monthly basis, right? So for those of you who don't like the quarterly billing, you also have the option of following the process that I just explained. It's very simple, and you will be billed on a month-to-month basis. Now, once you're enrolled in Medicare, your coverage is going to begin the first of the month that you turn 65. There is an exception to that rule. Anyone who is born the first day of any given month will actually have their Medicare Part A and Part B effective the month prior to them turning 65. And I'm going to give a slight example. Well, my date of birth is June 19th. So in my case, when I turn 65, I can expect for my Medicare Part A and my Medicare Part B to be effective the 1st of June, the year that I turn 65. But if I was born June 1st, rather than my Medicare Part A and Part B being effective the 1st of June, it wouldn't be. It would be effective the 1st of May, the year that I turned 65. It's just a rule that they have. So most folks will actually have their Medicare effective the 1st of the month they turn 65. But the exception to that rule is if you were born the first day of any given month, your benefit, your Medicare Part A and Part B will be effective the month prior to turning 65. Now, there's a very important question that we must ask ourselves. If we're turning 65 and we are covered for group health insurance through our employer, must I enroll in Original Medicare? And it's actually going to depend on your particular situation. Now, there is a rule for anyone that is at a job that has under 20 employees. Yes, you do have to enroll in Original Medicare upon turning 65. That is a rule that they have. But for anyone who's at a job with 20 or more employees, your situation is a bit different. you're going to actually have to gauge to see which route is in your best interest. So let's say if you desire to hold on to your coverage at your job, or let's say maybe you have to hold on to it because you have a spouse that is under your insurance as a dependent, or you have children that are under your insurance as dependent. In your case, it is going to be in your best interest for you to enroll in Part A since you've paid into it, and for you to delay the Part B to the time of your retirement or whenever you're in a position to where now you need to enroll in original Medicare. Now, at the end of this webinar, you are going to have the option of booking an appointment with myself. And during that appointment, I do a needs assessment. And what I do is ask a series of questions. And based off the answers that you give me, we're able to gauge which direction is best for you to go. So at the end of this webinar, don't hesitate to book an appointment with myself, and it'll be one-on-one, and we'll dive deep into your situation. And like that, we'll be able to assess and to see, based off your circumstances, which is the best route for you to go. Now, Medicare does have some major exposures, and what we'll be doing now is discussing some of those exposures. Medicare Part A, which is the hospital coverage, one of the biggest exposures that it has is the deductible. For 2024, it has a $1,632 deductible per hospital stay, and that is also per 60-day period. So what that means is, let's say someone was hospitalized on June 1st, they were discharged after 2 weeks, and 61 days later, they had to be hospitalized once again. Well, they would incur two deductibles. They would incur that first deductible that occurred June 1st, $1,632. And then 61 days after being discharged, let's say they got hospitalized again, they would incur another $1,632 deductible. So that's a major exposure. There are some things that we can do in order to avoid being, subject to those exposures. We'll be discussing that later. Now, on the Part B side, the doctor's coverage, there are also some exposures. As you see here, there's a $240 calendar year deductible, which that's not so bad. But where we have a problem is, do you see this co-insurance here of 20%? That is a problem. A good example that I can give is, let's say someone has a hip surgery for $100,000. Well, Medicare pays 80%. And then you're liable for 20%. So in the case of the hip surgery, Medicare will pay $80,000, and that's great. But then you would be liable for 20%, which is $20,000, and that is without limit. So that's a problem. Another area where we do see an exposure is, do you see this Part B excess charge? And essentially, what a Part B excess charge is, Medicare determines they're going to pay a doctor X amount for services that have been rendered, and that doctor has the right, if they don't want to accept Medicare assignment, they're able to charge an excess of 15% of whatever Medicare determined that they will pay for the services that have been rendered. So the best example I can give, let's say Medicare is willing to pay $100 for a particular service that has been rendered. Well, the doctor has the right, if they want to charge an excess of 15% of that $100. So, that is an area of exposure. Now, I have to add, only about 3% of doctors in this country actually would subject someone to these Part B excess charges. So they're not the worst thing. But the biggest area of concern is that 20% co-insurance. Later on, we'll discuss what we can do to avoid being victim to that. So now we're actually going to discuss some of the coverage options that you have, right? We did discuss the major exposures. So on your left and on your right, these are going to be the two routes that you can take in order to avoid being victim to those major exposures, right? And the left side, we have original Medicare, Part A and Part B. So what we have here to take care of those exposures is going to be the Medicare Supplemental Plans. They're also known as Medigap plans. And they come in and they fill in the gap to those vulnerabilities in regards to those deductibles that we mentioned, and in regards to the co-insurance, the 20% that we mentioned previously, right? So what the Medicare supplement does is it comes in and it fills the gap. So if someone, let's say, had that $100,000 hip surgery, and let's say they had a Medicare supplemental plan, right? And if they had the right Medicare supplemental plan and they had a copay of $20,000 for their hip surgery, that 20% coinsurance. So what would happen is that Medicare supplemental plan will pay that $20,000 on their behalf. So those who like the idea of original Medicare, yes, that Medicare supplemental plan does a great job at filling in the gap. And it really it almost eliminates any exposures. If you have the right plan, the only exposure you really have with Medicare supplement is that $240 deductible for Part B. Now, original Medicare does not cover prescription drugs. So if someone wanted to go the original Medicare route, you would have to also add a Part D prescription drug plan along with your original Medicare. And so long as you do that, you'd basically be fully covered. Now, on the other side, we have Medicare Advantage. And Medicare Advantage are run by private companies. And what Medicare Advantage plans do is it combines Part A and Part B. And typically, they will also have prescription drugs in it. So they may be known as MAPD, Medicare Advantage Prescription Drug Plans. And that is another way to avoid some of those major exposures that we discussed earlier, is by going the Medicare Advantage route. Some of you may have heard it as Medicare Part C. And later on in this presentation, we'll go into more details on how both of these options work. And you will be able to gauge and better understand which is the best route for you. So now we are going to be discussing option number 1, original Medicare. As we discussed previously, it does consist of 2 parts: Medicare Part A, hospital coverage; Medicare Part B, doctor's coverage. Because of those exposures that we also discussed previously, if original Medicare is what is in your best interest and what you prefer, we do have to complement it with a Medicare supplemental plan, also known as Medigap. And because original Medicare does not cover prescription drugs, we also need to add a prescription drug plan along with it. So that is going to be option number 1. And for those who are interested in original Medicare and who must complement original Medicare with a supplemental plan, well, these are all the different options that you have. As you see here, there's a bunch of different letters. Well, for the purposes of this webinar, we're going to zero in on Plan G and Plan N. For those turning 65, Plan G and Plan N are going to give you the most robust coverage. And as you see here on this chart, the Plan G, if you see the 100%, the only place that there's not 100% is going to be this X that you see here, and that's for the Part B deductible. And then you also see 80% for foreign travel, but that's coverage if someone is traveling internationally. But we're going to hone in on Plan G and Plan N, and we're going to go further into details how they complement original Medicare so well. Now, you may be wondering when is the best time for you to enroll if you want to go the Medicare supplemental plan route. A lot of folks choose to enroll 6 months prior to turning 65. One of the incentives behind that is you're able to lock in a lower rate. You're able to secure your monthly premium at a lower cost the earlier that you do it. It also helps folks to avoid making mistakes. If you know you're going to go the supplemental plan route, you already know that's the route that you would like to go. It's always good to do it earlier. You're able to get a lower rate, and it's just something that you're able to check off of your list. Something amazing about these plans is they're standardized. So a good example I can give is if you have a Plan G with Aetna or Humana or United Healthcare or Mutual of Omaha, those plans are standardized so that all of those various carriers are going to give you the same exact benefit. The difference is they're all going to have different premiums. right? So what we typically do is based off of your zip code, we shop around so we can see which reputable company is going to offer you the coverage that you need at the best cost. An example that I am giving for the purposes of this presentation is the average cost of a Plan G. Depending where you are in the country, it can range anywhere from $100 to $200 a month. This is going to depend upon your zip code, and it's also going to depend on the insurance company that you choose. Here, what I did was I listed just a few of the various Medicare supplemental companies that we represent. I put this here just so you can see that we do have many different options to shop around in order to gauge and to understand which plan is going to be more competitive for you. What we want to do is we want to go with the plan that has the most competitive rate, but is also a very reputable company as well. And we also want to make sure that whatever companies we're entertaining, that they are known to have steady premiums, that they won't have drastic rate hikes from year to year. Which is the best Medicare supplemental plan option? That's what we're going to be discussing now. It's really going to, for those turning 65, it's really going to boil down to the Plan G and the Plan N. And I'll go a bit more into details. As I discussed earlier, the Plan G typically will range from $100 to $200 a month. It's going to depend what zip code you reside in. And it's basically going to cover everything in regards to your health. The only thing is, on a year-to-year basis, there is a deductible for 2024. That deductible is $240. It tends to be around within that range. The year prior was $226. So I believe it went up $14 for the year of 2024. And once you meet that $240 deductible, if you have a Plan G, when it comes to your health needs, you have no other exposures. So someone can have a bill of $2-3 million, so long as they paid their Plan G premium and they met their $240 Part B deductible, they would incur no other coinsurance and no other copays if they had a Plan G, which is the reason why the Plan G really is an exceptional plan. Another good option is the Plan N. The Plan N's premium will tend to be maybe $20 to $30 less than a Plan G, depending where you are, what zip code that you reside in. And what the Plan N does is it has the same Part B deductible like the Plan G. So it's a $240 Part B deductible for the year of 2024. But what the Plan N does is for doctor's visits, you could incur a $20 copay, which is not so bad. And you can, for emergency room visits, you can also incur a $50 copay if you are not admitted, which is not so bad either. The area where there could be some concern is, do you see this Part B excess charge of 15%? The Medicare Supplemental Plan N, it does not cover the Part B excess charge. Like I stated earlier, there's only about 3% of doctors in the country that will not honor Medicare assignment. So it's very likely if someone has a Medicare Plan N that they'll ever come across that situation. But I must say that with the Plan G, you don't have to worry about the excess charge. And you also don't have to worry about copays for doctor's visits or copays for emergency room visits. But any one of these two, you'll be in excellent hands. They both will give you exceptional coverage. So now we are going to be discussing Part D, and Part D is prescription drug coverage. And I'm going to do the best that I can to make this interesting. This is not the most appealing thing to discuss, but it is very important. And I'm going to break it down. There are 4 different stages of Part D in regards to the prescription drug plans. Now, the first stage is the deductible stage. And in the deductible stage, that is the cost of your medication before your coverage kicks in. So anyone who has a plan that has a deductible, they are going to pay the full cost of the medication till they reach the deductible. And once you reach the deductible, now you exit the deductible stage and you enter into what is called the initial coverage stage. And in the initial coverage stage, that is the cost of your medications. That's the cost that you pay towards your medications, and also the cost that the plan pays towards your medications. And now when the cost that you pay towards your medication and your medications and the cost that the plan pays towards your medications, when it reaches and exceeds $5,030, now you've exited the initial coverage stage and you enter into what's called the coverage gap. In previous years, it was known as the donut hole. And in the coverage gap, what happens is you pay 25% of the cost of your medications, whether they're generic or whether they're brand name medications. You would pay 25% of the cost until the cost of those medications reach $8,000. Now, the $8,000 does not come from the member solely. What happens is the member pays 25% of the cost, and the remaining 75% of the cost is covered by the prescription drug plan and the manufacturer. So now when the 25% the member pays and the 75% that the manufacturer and also the prescription drug plan pays, when those two coinsurances reach $8,000, now you exit the coverage gap, and now you've entered into the catastrophic stage. And in the catastrophic stage, the cost of the medication go to zero. So for 2024, the most someone can spend on their medication is $3,300. So if someone has very costly medication, they have something called a troop, and that basically limits the member's exposure to spending large amounts in regards to the medications. And the government has put some laws into place where now in 2025, it's going to be even less exposure for high-cost medications. In 2025, the most someone is going to be able to spend on their medications, even if they have very costly medication, is going to be $2,000. So a lot of folks are looking forward to that. Now, we do have a process, right, when it comes to determining which prescription drug plan is in your best interest. And what we do is when we do that needs assessment, we will get the list of your medications, and we have a system that we plug your medications into, and we also select your preferred pharmacy, and we also put your zip code. And once we do that, what's going to happen is it's going to populate all of the plans that are in your area. And what we're going to do is we're going to look to see which plan or plans will have all your medications covered. And what we try to look for first and foremost is at no cost. And if at no cost is not possible, then what we do is we look to see which plans or plan will have your medications at the lowest cost possible. Now, once you've enrolled in the plan of your choice, every single year we need to touch bases. From October 15th to December 7th is when folks are able to look at their plan options for the upcoming year. And there's a lot of volatility when it comes to the prescription drug plans. Formularies can change, right? And also sometimes a particular drug plan, the cost of that plan may go up substantially. And in those cases, if that does happen, then on a year-to-year basis, we evaluate to see how your particular plan is looking for the upcoming year. And if need be, we will make a switch. But if your plan is still strong and still doing all that you need it to do, then it will remain as is. But with the Part D prescription drug plans, we always want to make sure that you're in the best position that you could possibly be in. Another important thing for us to discuss is the Part D late enrollment penalty. I come across so many persons that had no idea that they needed to select a Part D prescription drug plan upon enrolling in original Medicare. And as a result, when they did finally elect to enroll in a prescription drug plan, now they incurred a 1% penalty for every month that they could have had coverage but did not. So if you're wondering, do I need Part D coverage? The answer is yes. Unless you have what they deem to be credible coverage, yes, you do need to enroll in a Part D prescription drug plan. For right now, there are plans that are as low as zero premium. We don't know if that's going to be available for the upcoming year, but there's plans as low as zero premium, and there's plans as low as 50 cents or $5. But depending on which medications you take, there are also plans that are more costly. And our needs assessment is what helps us gauge which direction is best for you to go in your particular situation. So now we are going to do a brief recap in regards to Original Medicare. Now, if Original Medicare is the best route for you to go, remember the Part B premium for 2024 is $174.70. And because of those major exposures, we need to add a supplemental plan, right? Which is the premium for that is going to vary based off of your zip code. And because Original Medicare does not cover prescription drug plans, we also need to add a prescription drug plan. And the cost of that is going to vary. It's going to be based off of your zip code, but it's also going to be based on the medications that you take as well. So that is just something for us to keep in mind. If the Original Medicare route is the option for you, essentially, this is what you're looking at, the $174.70 a month for Part B. The cost of the supplemental plan, remember, it ranges throughout the country anywhere from $100 to $200. And the prescription drug plan, where it's a little tough for me to tell you what you can expect. Some for now, there's plans as low as zero, but we don't know what 2025 is going to look like. But for the year of 2024, throughout many parts of the country, you can find a Part D prescription drug plan for no cost. There's some as low as 50 cents, but it's going to depend on the medications that you take as well. Now we are going to be discussing option number 2. So let's say the Original Medicare route with a Medicare Supplemental Plan is not the best route for you, right? Let's say it doesn't work for your particular circumstance. Then the next option is going to be a Medicare Advantage plan. And Medicare Advantage plans, they basically run like any insurance that you and I have had throughout our lives, right? They're usually going to be HMO plans or PPO plans. If you go the HMO route, typically you'll need referrals in order to go to specialists, right? And if you go to PPO route, you don't need referrals, and it gives you the flexibility to go in and out of network, where in comparison with the HMO, you have to stay in network. And now these plans are run by private companies, and the Medicare Advantage plans, what they do is they combine your Part A and your Part B, right? And typically they'll also include Part D, right? So that means everything will be embedded into one plan. You don't have to get any additional plans, right? And in order to enroll in a Medicare Advantage plan, the only thing is that you have to continue to pay your Part B premium. For 2024, the Part B premium is $174.70. Throughout most of the country, you will find Medicare Advantage plans that are zero premium plans, but not throughout all of the country. There are remote areas where Medicare Advantage plans are not available, and if they are available, there's a premium that is associated with that plan or those particular plans. Now, these plans will have co-pays, right? They'll have co-insurances. Some of them may have deductibles, and they will also have out-of-pocket maximums, which is it's essentially a limit on how much someone can spend in a given year. So that's typically how the Medicare Advantage plans will work. The next thing for us to ask is, how do I enroll in a Medicare Advantage plan, and when do I enroll? Well, when someone is turning 65, they have the initial enrollment period, right? Which is which essentially 3 months prior to turning 65 that you can enroll in your plan, right? And it will be effective the month that you turn 65 unless you were one of those folks that were born the first day of any given month. Your plan will actually be effective the month prior. And Medicare Advantage works a little different than supplements. I know during October, you typically see an increase of commercials that are in reference to Medicare Advantage. And the reason behind that is there's what's called the annual election period. And that is from October 15th to December 7th. And essentially what it is it gives everyone who has a Medicare Advantage plan the opportunity to shop and to see, is their plan still the most competitive, or is there a plan that is going to be available in the upcoming year that's going to be better for them, that's going to provide more comprehensive benefits, or that's going to just do something that their current plan doesn't do at the moment. During the annual election period, also, those who have Medicare Supplemental Plans or just original Medicare and who would like to leave Medicare Supplement or leave original Medicare to enroll in a Medicare Advantage plan, they also have the option of doing that. Any changes that are made during the annual election period become effective January 1st of the upcoming year. So now we're going to do a brief comparison in regards to the two options that you have, right? Once you have acquired Medicare, once you have Medicare Part A and Part B, as we discussed, there are those exposures, and what Medicare Supplemental Plans do and what Medicare Advantage Plans do is they limit those exposures, or in many ways, they eliminate those exposures, right? So now on the Medicare Supplemental side, Medicare Supplement is quite convenient because it gives you the ability to see any doctor in the country, right? 90 some odd percent of doctors, I think 97 or 98% of doctors throughout the country accept original Medicare, right? And you don't have to worry about referrals, and you will not have to worry about networks. And for the most part, you will not have to worry about prior authorizations, right? So that is the convenience and the beauty in regards to Medicare Supplemental Plans. Now, Medicare Supplement Plans do not have, they do not cover prescription drugs. Original Medicare does not cover prescription drugs, so you would have to get that prescription drug plan as we discussed. It does not cover dental, vision, and hearing, so you would also have to get a supplemental dental, vision, and hearing plan if that's something that you would like. And now on the opposite side with the Medicare Advantage plans, the Medicare Advantage plans, right, they are run by the private companies. They're going to be that HMO or PPO option typically, right? And for the most part, they will include drug coverage. And for the most part, they will include dental, vision, and hearing, right? And for the most part, they throughout the country, you'll find places that have zero premium plans available. Now, the thing is, because they're HMO and PPO options for the most part, right? For the HMO, you will need a referral for the most part to go to a specialist, and you have to stay in network, right? And with the PPO, you don't need a referral, and you can go in and out of network, but if you go out of network, it will be at a higher cost, right? So the Medicare Supplemental Plans, they are it's a little more costly on the front end, but it gives you a great deal of security on the back end. And the reason being is if you go the Medicare Supplemental route, you know you're going to pay your $174 a month for your Part B premium. You're going to pay your Medicare Supplemental Plan premium as well. Let's say it's $100 a month. So let's say we're at $274.70 just to make the math a little easy. And let's say for the purposes of 2024, you enroll in a prescription drug plan that is no cost, right? So for $274.70 a month, you know you're not limited to network. You don't, for the most part, you will not need prior authorization for various services that must be rendered, right? Anywhere in the country that you go to, you know that you can receive medical attention without any issues, right? But now on the other end, so let's say if it's a bit inconvenient, right, to not only pay the Part B premium, but to also pay the supplemental plan premium, well, Medicare Advantage is a great option. As long as you continue to pay your Part B premium throughout the country, you'll find plans that have zero premium plans available. So it all depends on your situation, right? Some folks will be adamant and say Medicare Supplemental Plan is the best way to go. And in a perfect world, it is great. It is a great option, but I also know it's not practical for everyone to go the supplemental route, right? It is an amazing option. It gives you a great deal of flexibility, and you know exactly what you can expect to spend in a given year. Well, on the Medicare Advantage side, it's hard to determine how much you'll spend. You may have co-pays to see a specialist. You may have co-pays to see a primary care doctor. You have co-pays for like surgeries. You have co-pays for emergency room visits. And things of that nature. So there's a lot more with the supplemental side. You're able to gauge and to understand exactly what you could expect to spend. You'll pay your $174.70. You'll pay your supplemental plan premium, right, on a monthly basis. You have your $240 deductible. Once you meet that, in regards to your health, you will not incur another charge. And you also have your prescription drug plan. We're on the Medicare Advantage Plan side. It works much like any other insurance that we've had, right, our whole lives, right? If you have an HMO, you have to abide according to the network, unless it's an emergency. And you need referrals, and there's co-pays, co-insurance, out-of-pocket maximums. So for the most part, it all depends on your situation. That's the beauty of the needs assessment that we do, based upon our conversation and the information that you bring to my attention. It will help us gauge and understand which direction is best for you to go. There's not one size fits all, because everyone's situation may be a bit different. And I really look forward to discussing with you all to see which is going to be the best option for you. Congratulations, everyone. You made it to the end of our webinar. I truly hope you have found this information valuable. I hope you took great notes. You completed phase 1, and I was just watching this webinar to the end. Now we're going to discuss phase 2. Phase 2 has to do with you booking that one-on-one appointment with myself. You'll be able to go on my calendar at the end of this presentation, and on that one-on-one appointment, we'll do that needs assessment that I discussed earlier, and that's really going to help me understand your situation. And once I understand your situation, I'll be able to provide you with these 2 bonus items that you see here. Bonus item number 1 is the personalized Medicare roadmap. And what that is a document that I will provide to you that, based on your situation, is going to show you what steps to take. When do you take this step? When do you take that step? It's going to make things very clear for you. And it's really going to make this a seamless process as you enroll in Medicare and you see which route that you have to go. Now, you also get bonus item number 2, and that is the personalized Medicare cost summary. And what that does, it paints a great picture on how much you could expect to spend on a monthly basis based on your situation. If you're going to go the original Medicare route with a supplemental plan, it'll show you how much the Part B would be, how much the supplemental plan would be, and how much the Part D prescription drug plan will be. If you go the Advantage route, the Medicare Advantage route, it'll be the same thing. It'll show you how much your Part B premium will be. If there's a premium associated with the Medicare Advantage plan, it will show you that. If there's no premium, then you won't have to worry about that. But it will give you a clear picture and a clear understanding of exactly what you'll be looking at as you are not only enrolling in Medicare, but as you have to make a very important decision on which direction is best for you to go. Now, phase 3 is what we do exceptionally well. We provide lifetime support, right? It's a concierge service that we provide. We want to make sure that we take care of anything that you can possibly need help with, whether it's billing, whether it's claim services, whether it's any questions or concerns that you have. We always want to be there for you. And we pride ourselves in this. And another thing that we do is we want to make sure we meet with you on a yearly basis, minimum, to make sure that you're always in the best position that you could possibly be in. Now, you have made it to the end of this presentation. It truly has been a pleasure to do this presentation. I have a passion for this. I love it. And I hope that you've also loved it as well. I hope that you all have a blessed day. And I look forward to meeting with you all very soon. And you're about to see the option for you to click a gold button. I advise that you click that gold button. It's going to lead you to my calendar and give you the option to book in that appointment with me. I look forward to seeing you soon.